Anxiety is an evolutionary thing that keeps us safe. It activates our flight or fight response when we perceive some sort of threat. It's normal to feel some anxiety in a stressful situation, like in an exam or a job interview, or to be worried after a big life change or traumatic event. But if anxiety doesn't go away, happens really frequently, or is really strong, or if it stops you from doing things you want to do or need to do, it can become a problem and might mean you have an anxiety disorder. Anxiety disorders are common and can affect people of all ages. In fact, children as young as 3 can have an anxiety disorder. But anxiety is treatable and it doesn't have to dictate your life forever. What are the types of anxiety disorders and what are their symptoms? There are different types of anxiety disorders. There's generalised anxiety disorder, which is essentially a disorder of worry. While everyone worries sometimes, people with generalised anxiety worry a lot and find it really, really difficult to stop worrying. The worry gets in the way of their life, making them unhappy and unable to do what they want to do or what they have to do. People with generalised anxiety worry about lots of different things: money, relationships, school, work, natural disasters, things they might have said, pretty much anything. And they ask lots of what-if questions, like what if there's a flood? What if my friend is angry with me about what I said? What if my parents get a divorce? Generalised anxiety tends to occur from the age of about 7, when children have the cognitive capacity to ruminate about past events and worry about future ones. It's not very common in children under 7. Social anxiety is another type of anxiety disorder. People with social anxiety disorder are very anxious in social situations, particularly when there's unfamiliar people around. They worry that they're going to do something or say something that will be embarrassing and that others will evaluate them negatively and think less of them. This is different from introversion, where people might just prefer to spend time on their own. Introverts are not necessarily anxious. Everyone can get a bit nervous in social situations, but those with social anxiety disorder find social situations extremely anxiety-provoking. They might find going to school, work and parties really difficult, and so they might avoid those situations entirely, or they might attend them but feel really distressed while there. Then there are specific phobias, another type of anxiety disorder. And there are lots of different types. People can have a fear of spiders, of dogs, of snakes, of heights, enclosed spaces, costume characters, lifts, all sorts of different things. And sometimes people think this sounds like a good thing, like it makes sense to be scared of snakes. But the difference is that a person with a specific phobia might never go for a bushwalk or go into the garden because they're so fearful that they might encounter a snake. They might not even be able to look at a picture of a snake. If your fear goes over and above what might be a normal response to the point that it starts to become debilitating, then it could be considered a specific phobia. There's also separation anxiety. This is most common in children, but teenagers and even adults can also experience it. Those with separation anxiety are really worried about being away from their parents or away from home. They're worried that something bad's going to happen to either themselves or to their loved one when they're apart. Children with separation anxiety might not want to go to sleep on their own. They might be clingy at school drop-off or when they're dropped off at a party. They might not be able to do school camps or sleepovers, and they might really worry when their parents late picking them up. And although less common, teenagers can also have separation anxiety disorder, and this can be really tough for them because it's less developmentally appropriate and they can get a really hard time from their classmates and from their friends. And then there's panic disorder. Now, panic attack is an intense physiological response to some sort of fear or anxiety. A person's heart might beat really quickly, or they might feel lightheaded or short of breath. And it's so intense that they feel that they might die or go crazy. Now, lots of people have had a panic attack at some point in their life, and panic attacks can occur with any of the anxiety disorders. So, for example, someone with a phobia of spiders might have a panic attack when they see a spider. But with panic disorder, the panic attacks seem to happen out of the blue and for no reason at all. And because people feel like it's come out of the blue or come out of nowhere, they start to fear that they're going to have another one. And then their fear can bring on a panic attack. Panic disorder can also lead to something called agoraphobia. So when people become worried about having a panic attack somewhere where they can't escape or get help, like on a train or a bus or at school or a shopping centre, and they can be worried that they'll embarrass themselves, so they stay home and they start to fear going out. How is an anxiety disorder diagnosed? You need to see a psychologist or a psychiatrist to properly diagnose an anxiety disorder. Because everyone can experience anxious feelings, people can be tempted to self-diagnose, but feeling anxious is not the same as an anxiety disorder. A psychologist or a psychiatrist will have seen the whole spectrum of anxiety and will be able to tell if yours is in the normal range or if it might be a disorder. They can make a judgment based on the types of symptoms, the severity of symptoms, and then they can work out a treatment approach for you. Even without a diagnosis, you can work on managing your anxious feelings. There are many online resources available that can help you get started. When should you see someone about anxiety? Anxiety is a normal human emotion. Everyone experiences it, and it can be useful to us. It stops us from doing stupid things. But if anxiety is very severe and very frequent, or if it stops you from doing things that you have to do or you want to do, then it can be helpful to get some support. People will often wait until they're completely incapacitated by their anxiety before they seek help, which can mean that their anxious behaviours and thinking's even more entrenched and harder to treat. In Australia, you can see a GP to get a mental health plan so that your sessions with a psychologist are at least partly subsidised by Medicare. You can let them know if you have a psychologist you'd prefer to see, or they can refer you to a psychologist if you don't have someone else in mind. If you're a parent and you're worried about your child and that they're overly anxious or they're becoming more fearful or avoiding certain things, it can be really helpful to see somebody early. What are some of the causes of anxiety? There are multiple causes of anxiety. There's a genetic component, so if you have an anxious or a depressed parent, you're more likely to have anxiety yourself. Those who are predisposed to anxiety like this were often born with an anxious temperament, in particular something we call behavioural inhibition. Now, behaviourally inhibited children are shy and they feel anxious particularly with unfamiliar people or in unfamiliar situations. People often blame parents when children are anxious, and this is really something we shouldn't be doing. When a child is anxious, it's really hard for parents. They respond differently to an anxious child compared to how they would respond to a non-anxious child, and they parent them differently. In fact, oftentimes parents will have one anxious child and one non-anxious child, so it's not all about the parents. And it's important to be kind to parents of anxious children because parenting an anxious child is really hard. That said, sometimes parents can inadvertently trigger anxiety in their child. For example, if a parent has a phobia of dogs, then they might tell their child to stay away from dogs in case they get bitten. And that can lead the child to have a fear of dogs. But that happens less than you might think. More often what happens is that when a child's really fearful of something, a parent, and other people as well, will allow the child to avoid that thing. For example, if a child's scared of dogs and gets really upset when one's close by, the parent might walk in a different direction with the child or make sure the child doesn't see the dog. The child then doesn't get the opportunity to learn that there wasn't anything to fear. Avoiding what we're frightened of really keeps anxiety going. It feeds it. And this is true for people of all ages, not just kids. Anxiety disorders can also be caused by a traumatic event, like if a child's been bitten by a dog or been in a house fire, and the traumatic event can lead them to fear that certain thing or that situation. How do you treat anxiety? Now, we don't want to get rid of anxiety entirely. It keeps us safe in small doses, but we do want to make it manageable. The best treatment available at the moment for anxiety disorders is cognitive behaviour therapy, or CBT. This is a psychological treatment that looks at cognition, or thoughts, as well as at behaviours or actions. The most important part of that therapy is a strategy we call exposure, where people learn to face their fears instead of avoiding them. With gradual, incremental exposure to what they're frightened of, people don't get overwhelmed and they learn to face their fear and manage it. CBT also involves identifying unhelpful, anxious thoughts and replacing them with more helpful or rational ones to help to reduce anxiety. Will I need medication to treat my anxiety? Both CBT and medication are useful for treating anxiety. For children, we tend to use CBT rather than medication. The positive aspect of CBT is that it teaches people strategies to manage their anxiety that they can then take with them throughout their life and can be used at any time when they feel anxious. What management tools are available? At Griffith University, we have a range of digital mental health programs that are very effective at treating and preventing childhood and adolescent anxiety. These programs can help parents support their children so they can better cope with their worries. Beyond Blue also provides information on different tools that can help you if you have mild or moderate anxiety or you're not ready to see a therapist yet. Can anxiety be prevented? The best thing we can do to prevent anxiety is to make sure we don't start avoiding the things we're frightened of. The more we avoid, the more anxious we become. So we need to notice when we're starting to avoid something because it triggers some anxious feelings. We can have a strong urge to avoid what we're frightened of, and for parents, it can be really challenging to put a child in a situation that makes them feel fearful. You don't want to jump in at the deep end and put you or your child in a situation that's really distressing, but recognizing and gradually managing exposure to whatever it is you're avoiding, whether that's social situations or a specific thing, in a safe way, can go a long way to preventing your anxious feelings from developing into an anxiety disorder.